Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro, bringing you Technique Tuesday. We're going to do a series of videos now that are for basic shoulder health or posture health. So to begin with, we're going to do a row, okay, with a Theraband or a tube. Most of you get it, but typically you're going to anchor it in a door, okay? So open up here, you're going to see our messy office in there, and shut it. That's it. So that's secure. Okay. The farther you back away, the more tension there is, the more the muscles are going to work. Okay. So you've probably determined either just by listening to your own body or working with your physical therapist how much tension you want. So this first one is called a row. Typically, I like to have people stagger their stance when they do this. The reason being is when they stand with their feet together, I find that people are really likely to arch in their low back. So this just helps you to maintain an upright posture, I've found. All right, so band is anchored, and it's anchored at a height so that when you pull back this way, elbows into your sides, your ribs, they're about the same height as your hands and your elbow, okay? So you're gonna be grabbing the band. I'm wrapping it around my wrist just because this is a long tube. You know, normally you wouldn't do that. So you're here, staggered stance, core is a little tight just so you're not arching your back or anything. And you're just going to pull your elbows back so that they're into your sides, forming about 90-degree angles at your elbow. Pull here, and then also, because it's working on muscles that kind of bring your shoulder blades together, you want to emphasize bringing the shoulder blades together in the back. A little bit of a pinch. Okay? So you're here, a little bit of a pinch, elbows coming to 90 degrees, and we're pinching. That's it. That's your row. Typically, I'm prescribing 3 sets of, you're over here, 3 sets of 10 to 15 reps, okay? Once or twice a day. Yeah, that's the main thing with that exercise, 10 to 15 reps. The farther you move away, the more you're going to be working. So come here, pull the elbows to about 90 degrees. Some people have shoulder conditions where if they pull back here, it's not going to feel good. And so if that's the case, don't do it. Typically, you're going to stop just where you're flush. Like if the wall were behind you, you don't want your elbows to come past that wall, okay? Yeah, so if it hurts to do this, don't worry about it. Pull back, shoulder blades pinch together a little bit, and then back, maintaining an upright posture. Biggest thing with this one that I see mistake-wise, some people engage their upper trapezius, so they'll do something like this. That we're not looking for that in this exercise, so keep the shoulder girdle down, depressed a little bit, and just bring them back. That's it. Another thing I'll see, where instead of pulling this way, and see I'm bending my elbows and bringing my shoulder blades together. Some people do this kind of sweeping motion where they'll do this. And you know, that's another no-no. Just pull straight back, elbows coming to 90 degrees, pinching the shoulder blades together. Anywhere from 10 to 20 reps, 3 sets, okay? And it's usually pretty good, even if you have I've seen people with severe rotator cuff injuries, and they're able to do this exercise without much pain. So it's a good way to start. Okay, it's strengthening and activating the muscles between your shoulder blades. Row. Although sometimes it's also called a low row, so you might search the YouTube video. I just say row for short, but it's also considered a low row because your elbows are low, they're down. Okay, I'll do a high row in the next video. Like us on Facebook, like the video, leave comments or ask questions below. We'll be happy to answer them. Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro. Technique Tuesday, check with your physical therapist or physician before doing any of these to make sure they are appropriate for you. Thank you.